Now, it is estimated that the economic cost and burden of smoking in Ghana is nearly 100 million Ghana cedis, making it a major public health threat. What will be an ideal strategy to stop or reduce tobacco smoking in the country? This morning, the Ghana Revenue Authority, the Food and Drugs Authority, the Tax Justice Network, the Vision for Alternative Development, VILD, as well as other stakeholders met at a forum to discuss strategies to make tobacco use unattractive. Key among the solutions was increased taxation on cigarettes and other tobacco products. But what is the guarantee that people won't find a way around this? In the studio with me is Musah. He is the Executive Director in charge of Programs and Vision for Alternative Development and the National Coordinator of the Ghana Non-Communicable Disease Alliance. I'm grateful that you could make it to the studio, Mr. Labaram.
Thank you so much for having me.
So let's look at the objective of this forum you had today. What's the objective?
Well, so thank you very much. Indeed, we felt that there was a need for us to have a national discourse to discuss how, as a country, we want to proceed with the issues of tobacco in the country. Because we thought that tobacco is a menace, it's a killer, it has no known benefit whatsoever, and then to kill and destroy, and then, even make people homeless. So we thought that, and this has been going on for many years. We have been making efforts, through, a lot of interventions, one-on-one engagement, but for there's a need for that kind of broader stakeholder consultation so that we can all meet together and then have that kind of, frank discussion among ourselves.
So you met people from GRA, you met people from Tax Network, you also met people from FDA. What are their positions on this? Okay,
so indeed, let me say that there has been a lot of support with respect to increasing taxes. In fact, the focus of this program was to increase taxes on tobacco products because we thought that that's one of the most effective means of reducing consumption of tobacco products, and then also serve as a revenue stream for government. That's why you find the GRA and the Ministry of Finance also being interested in this program because we thought that there's an opportunity for us to also look for an untapped avenue where government can also get some revenue to help in the development of the country. So and there was a lot of buy-in from almost all stakeholders. And to the extent that the GRA has kind of promised that they're going to have that kind of discussion so that together we can see how we can proceed. Indeed, let me say that since 2015, there hasn't been any tax increment on tobacco products. And this has led to, the low cost of tobacco in the country. So when you go around the country, you'll find cigarettes products very cheap in the market. So if you have close 20 pesos to 30 pesos, you can buy a stick of cigarettes, to smoke. In the same vein, a pack of 10 cigarettes can cost you about 2 cedis. And what is 2 cedis in Ghana today? Elsewhere, cigarettes has been, it's one of the most expensive products.
Okay.
But when it comes to Ghana and other part of the country, other part of the developing countries, cigarette products are very, very cheap. So we're looking at how do we, as a country, look at how do we increase, but we're not just looking at increment tobacco products. We're looking at changing the tax regime because research shows that the current tax regime we are using, which is the ad valorem tax system, it is not helping. So even when we increase tobacco by even 20%, still the price will remain cheaper in the market because the industry has devised so many strategies, including absorbing the price difference, so the price will remain the same in the market without any effect. Or sometimes there's a saying that they also try to alter the product by putting or coming up with inferior commodity. And the point is already the commodity is dangerous, and now you want to now kind of. So these are all indications that the industry is very much interested when it comes to issue of taxation, and they try to ensure that countries like Ghana and other developing countries will continue to use a tax regime that will not help to raise the tax burden on tobacco products.
But what's the guarantee that imposing more taxes would actually reduce or scare people from using tobacco products?
So that's why I said earlier that even when we increase tobacco, the current tax regime is a problem. That's why we feel that there's a need for us to come together, including GRA. Okay. So once GRA is on board and they've bought into the idea, because all this while, from 2015, they've been talking about the fact that we need statistics, we need evidence. Okay. So the evidence was actually developed. Last year, we spent a lot of time and energy, and we came out with this document, The Economics of Tobacco in Ghana. So this is looking at, I mean, the ecosystem of tobacco in the country, looking at what are some of the effects and what are some of the best strategies, including best world practices that Ghana can also learn from, especially in Kenya, in Kenya, in Gambia, in Rwanda. They have put together a very good tax system that is helping to reduce the prevalence of smoking and its related diseases, like non-communicable diseases, that is afflicting us, I mean, as a country. Because we are told that 94,400 people die from tobacco-related, I'm talking about non-communicable diseases. And tobacco is one of the major risk factors for all the non-communicable diseases that we know. But the point is that this commodity has no benefit. So why don't you look for a way of disincentivizing, the public, especially the youth and the poor? Because research also shows that, see, the taxes that they impose on tobacco is actually to protect the young ones and the poor. Who are, because if you have 20 pesos, the rich man will not bother about 20 pesos. But the commodity is so cheap, they're saying that children will now be initiating their habits, and also to be enticing to use the product. And eventually, once you start using the product at the age of, at the teen age, then you become hooked to tobacco. The industry would not, and their interest is not on those who are already smoking. The interest is how do we get new clients, the young ones and those who have not smoked before. And that's why the attention has been on the shisha, because they come up with so many attractive commodities to attract the young ones, especially the university students. That's why we now see shisha all over the place. The commodities are dangerous, as we all know. But the point is that because of the way it has been fashioned, it has been designed, so it's so attractive. And we are told that our ladies are going into it more than even the male counterparts. Research is showing that the percent of women who are into shisha is higher than that of men. It's all because the product is attractive.
Yeah.
To what extent? Because the price is also very, very good, very affordable. So we are calling for an increment, but not just increment, looking at how do we change the tax regime. So that's a conversation we are currently having with.
But why don't you call for a complete ban if you actually admit that it has it's weighing down the economy?
Right. See, this discussion have come up several times, and I think at the global level there are discussions on the end game. They call it the end game. How do we end tobacco product? But policymakers will tell you that it's good to regulate a commodity than to put an outright ban on it, because the moment you put an outright ban on it, then it becomes extremely very difficult to regulate or to be able to, because of issue of smuggling and all of those things. But the point is that there are efforts by the WHO and other war-meaning countries to see how we can end tobacco and its related, but currently, as we speak now, no country have been able to ban tobacco. What we are trying to do is that how do we ensure that we regulate it to the extent that we also benefit from it, so that the point is that if somebody is selling something, you don't buy it, definitely he will close up his business. But they have the money. I mean, it's a multi-billion, company. So they are able to invest a lot of resources to see how they can attract people to still smoke the commodity. And I always say that it's one of the evil commodity that the world has ever produced. Because why do you produce a commodity, that stick of cigarette? It consists of about 7,000 chemicals. That commodity alone. Apart from the fact that the commodity is coming from a plant called Nicotiana tabacum. That particular plant already has some chemicals. Then they inject so many chemicals into it. And all those chemicals are very hazardous to every part of the human body. So the point is that it is not any commodity that we should glorify or play around it. We should take a very bold step as a country to see how best we can reduce the extent to which people are smoking, and also see how we can get some revenue, because the industry will say that no matter how you increase, people will still smoke. No problem. Let them smoke so that we also get revenue from it. At least when people now fall sick, they get the cancers, the heart diseases. When they go to the hospital, we can compensate them with the taxes that they are paid, to take care of them. Because currently, the healthcare cost is just too much for the country.
So how do you intend to implement the recommendations from this forum? Well,
so the recommendation actually is for us to ensure that government implements them. So there's going to be some in-house one-on-one meetings with the Ministry of Finance and the Ministry of and GRA, because they are the main tax policy, institutions in the country. We are looking at how do we ensure that we get a policy framework that will change the tax regime from where we are to either a specific tax or to, or to a mixture of the two, specific and ad valorem, because there has been so many directives from the WHO and then also from ECOWAS that a mixture of the two, which we are recommending, is the best way to go for many countries, including Ghana.
Okay. I wish you all the best in this endeavor. Definitely, it's something that you are passionate about. And so when is this meeting coming on?
Well, so this meeting has been scheduled from next week and then the weeks ahead. And hopefully we would ensure that the media is also involved so that we can continue to promote this advocacy. Because we all need to ensure that we reduce this.
I'm grateful for your time. Labram Musah is the Executive Director of the Vision for Alternative Development and the National Coordinator of the Ghana Non-Communicable Disease Alliance.